Mr. President, the Senate will be going home this week for the 4th of July recess, and most of us will be back in our homes with our families and in our hometowns and moving around. I still think the topic of conversation is going to be health care. I think this conversation debate in Washington has really touched a lot of families and businesses and individuals across this country. The reason I say that is because 6 years ago, or about 6 years ago, I voted for the Affordable Care Act, what's known as Obamacare. And for the longest time, I was sure that was the right vote. I still am sure today. But I wondered why people didn't appreciate it. Because what we tried to do, and achieved some success, was to provide health insurance for a lot of people in America who didn't have it. In my state of Illinois, we cut the percentage of uninsured people in half because of the Affordable Care Act. A large number of them are now covered by Medicaid, and a large number are able to buy health insurance through private insurance exchanges. But for the longest time, when you ask people across America, what about Obamacare? What about the Affordable Care Act? Mixed reviews. Less than a majority supported it. And then we embarked on this conversation, this debate in Washington in the Senate over the last 6 months, and an interesting thing happened. When the Republicans who were in majority in the Senate and the House, who were determined to repeal Obamacare, set out to do it, they found out it was a big, heavy lift. So now today, we have an interesting thing that's happened. For the first time in the last several weeks, a majority of the American people support the Affordable Care Act. All those years after we passed it, when we were talking about the good things it did, people were skeptical. But when the notion of repealing it came up, people started saying, well, what would I lose if you repealed it? And when they thought about what they would lose, they decided those things were valuable to them personally and to their families. And what were those things? Some pretty basic things. First, that you would have access to health insurance. I told the story repeatedly of my friend Judy. Judy is in hospitality. She works in a motel down in southern Illinois that I stay in from time to time. A sweetheart of a lady, 62 years old, who has had jobs that don't pay a lot of money, but goes to work every day. There's not a lazy bone in her body. 62 years old, Judy has never had health insurance in her life until the passage of the Affordable Care Act. Now she qualifies for Medicaid, and thank goodness she does, because she's been diagnosed with diabetes, and she needs a doctor she can count on and good medical advice. So when we say that we were passing the Affordable Care Act so that more people would have access to health insurance, it's happened. And we also said we're going to change the health insurance policies you buy so that you don't get tricked into buying something that is going to provide protection, but only enough and not enough when you really need it. For example, there used to be lifetime limits. People would buy health insurance and say, I'm going to keep the premium low, I'll sign up for a lifetime limit. How could I ever need health insurance for more than $100,000 a year? Well, it's an eye-opener, but there are many diagnoses or accidents that could happen to you next week that'll cost more than $100,000. And a lot of people found themselves facing personal bankruptcy because they had a limit on their health insurance policy and just faced a cancer diagnosis and knew that they'd have to spend $150,000 or $200,000 for the most basic care. We also said that you can't discriminate against people when you sell health insurance because of a pre-existing condition. Well, it turned out insurance companies defined pre-existing condition to include everything. Acne when you were a teenager, asthma, you name it. In fact, they went so far as to say that being a woman was a pre-existing condition. Some of those things made no sense, and we said, that's over. We're not going to let that happen anymore. 1 out of 3 Americans has a pre-existing condition. You can't discriminate against a person because they're in a family with a child who's survived diabetes or is living with diabetes, or a spouse who survived a cancer surgery. So we said from now on, under the Affordable Care Act, when you buy a health insurance policy, it's going to cover the basics. We did something else, which I want to mention because I don't want it overlooked. There used to be a senator back here in the second row, or the last row, second seat, Paul Wellstone of Minnesota. Paul Wellstone was a great guy. You couldn't help but love him, whatever your politics. And over here was Pete Domenici. And he was a conservative Republican senator from New Mexico. Wellstone of Minnesota, Domenici of New Mexico. What would those two have in common? What they had in common is each of them had someone in their family with a mental illness. And they watched what happened to that loved one in their family. And the two of them teamed up and said, you know what? From this point forward, when you buy health insurance in America, it's not just going to be physical health that it's going to cover, it's going to be mental health. Because so many families are touched by mental illness, some very serious forms, some not so serious, but need medical help. They all should be covered. And so they put that provision in the Affordable Care Act. So now when you buy a health insurance policy in America, it's not hit or miss. It covers mental illness, as it should. Then they added a provision which most of us didn't pay attention to, and we should, and we do now: mental illness and substance abuse treatment. Think of this opioid and heroin epidemic and the people who are dying right and left. Think of the families who are just absolutely consumed by the addiction of a child, a teenager, wondering if they can get them into treatment so that they can save their lives. For many of them, that health insurance plan is paying for that treatment that otherwise would come out of their pocket if they could afford it. So we put all these things into the law, and the law took place. And when the Republicans said they were going to repeal it, people stood up and said, wait a minute, I have to face lifetime limits again? I have to face pre-existing condition prejudice again? I'm not going to have mental illness covered automatically or maternity care covered automatically? Well, when people reflected on this, they realized our vulnerability. So simple repeal was not enough. The Republicans needed to replace. If they were going to eliminate Obamacare and all the people protected by it, they needed to replace. And that's when the process fell apart. In the House of Representatives, they went through a process of writing the replacement. And when it was all over, they didn't wait for the Congressional Budget Office to analyze it because they knew what was coming. The Congressional Budget Office announced that some 23 or 24 million Americans would lose their health insurance by the plan that passed the House of Representatives. They also knew that people could face again discrimination based on pre-existing conditions. They knew that basic health insurance didn't include the protections that all of us really need to count on. Remember the provision in the Affordable Care Act that said that your son or daughter could stay on your family health insurance plan till you reach the age of 26? Pretty valuable, isn't it? That son or daughter that you like a lot and helped get through college was doing internships and looking for a job. You wanted to make sure they had health insurance, didn't you? Well, that was part of the Affordable Care Act. And a guarantee we want to make sure remains in any future change in the law, too. The House of Representatives passed their measure, and unfortunately, it was a partisan roll call. Only Republicans voted for it. It passed by 4 votes. 2 Republican congressmen had changed their votes. It would not have passed. Then the measure came over to the Senate, as you remember from your civics lesson, and the Senate had its chance. So what happened? We had a chance to take this question to the committees of the United States Senate, Labor and Health and Education Committee, which is chaired by Senator Lamar Alexander, a friend of mine, Republican of Tennessee, ranking member, Senator Patty Murray of Washington. We had a chance to take the bill to the committee and to debate a better approach in the Senate, to have public hearings and witnesses, but we didn't do that. Instead, the Republican majority said, we're going to do this on our own. We don't need any Democratic input. 13 Republican senators will meet in a room and write the alternative to the House health care replacement bill. And they did. And it went on for weeks, and no one saw it. There were no reports of what it included, what was inside of it. And then 6 days ago, it was announced. 6 days. And we took a look at it, and it wasn't that much different than what the House had done. The Congressional Budget Office released a report Monday of this week and said 22 million Americans will lose their health insurance under the Republican health care plan. 22 million. And this part was really troubling. There would be a dramatic increase in premium costs for people between the ages of 50 and 64. Some of them would see increases of up to $8,400 a year in premium costs because of the Senate Republican plan. So what was the reaction of the medical professionals across my state to both the House Republican plan and the Senate Republican plan? It was the same reaction. They said, Senator, vote against it. The Illinois Hospital Association said that if we cut back in Medicaid, hospitals, particularly rural hospitals and downstate hospitals, will have to cut back in services and may face closure. The doctors in my state, the Illinois Medical Society, came forward and said, vote against the Senate Republican plan and the House Republican plan because we know what happens when people lose health insurance. They still get sick. They don't come and see us early on where we can prevent things from getting worse. They come see us when things are pretty bad and pretty expensive and pretty dangerous. So the doctors opposed it, the nurses opposed it, the pediatricians opposed it. Not one single medical advocacy group in Illinois supported the Senate Republican bill that was unveiled 6 days ago. And when it came to pre-existing conditions, it wasn't just the medical groups that opposed the Senate Republican bill. The Cancer Society, the Heart Association, the Lung Association, most of the major disease groups stepped up and said, the pre-existing condition provisions in this bill are unacceptable. And sadly, the policies that are going to be sold may not cover the basics that people absolutely need. And then the other thing came out. What drove this whole debate, what started healthcare reform in the House and in the Senate, was not healthcare reform, but a tax cut. You see, the Affordable Care Act imposed new taxes, particularly on higher income individuals. And the money from those taxes went into sponsoring people into Medicaid, helping people pay their health insurance premiums. So the Republicans in both the House and the Senate said the first thing we'll do is to cut those taxes, about $700 billion worth of taxes. Ultimately, they took out $1.1 trillion out of our health care system with this tax cut and other cuts. And when you pull that kind of money out of health care in America, fewer people have health insurance, fewer people have a helping hand when it comes to paying their premiums. Well, the reaction to the Senate Republican bill over the last 6 years has been growing opposition. Growing opposition until yesterday, Senator McConnell announced, we're not going to vote on it this week. We were supposed to, but we're not going to vote on it this week. He said that he may return to it when we come back from the July 4th recess. Well, here's the point that I wanted to make on the floor today. I'm glad that we've reached this point, that these proposals by the House and the Senate are not going to move forward quickly and become the law of the land. Too many people would be hurt, too many innocent people, too many families would lose their health insurance. The cost of health insurance would go up dramatically. The premiums would go up, particularly for people over the age of 50. And we'd see hospitals facing closure across our state. We'd see cutbacks in treatment for mental illness and substance abuse treatment. The list goes on and on. It would have been a terrible outcome. And certainly doing this in order to give a tax cut to the wealthy people in this country makes no sense. Incidentally, how much is the tax cut? If your annual income is $1 million a year, under the Republican plan, your tax cut is over $50,000 a year. Well, the people who are wealthy aren't asking me for that tax cut, and the people who will suffer because of it are folks that aren't making anywhere near $1 million a year. Here's what we need to acknowledge. The current healthcare system in America needs to be improved. There are things in the Affordable Care Act which need to be addressed, and we need to do it in an honest fashion. And we need to do it on a bipartisan basis. I've talked to some Republican senators since Senator McConnell has pulled this bill back, and they want to sit down and talk. Senator McConnell said there'll be no conversations with Democrats. Republicans will do it by themselves. I hope over the 4th of July he reflects on that, because there are Democratic senators who in good faith want to sit down and make a better healthcare system for America so that more people have the peace of mind and security of health insurance, and so that it's more affordable for families all across the board. The biggest, toughest part of healthcare today is the so-called individual health insurance market. 5 or 6% of people who need to buy health insurance plans, they don't have it where they work, they don't qualify for Medicaid. Those are the ones that are seeing the premium spike. Can't we take the collective wisdom of the senators, Democrats and Republicans, and sit down and address that problem effectively? Of course we can. But we need to have a starting point. So my plea to the Republican leadership is to listen carefully, as our Democratic leader Chuck Schumer said yesterday. Once you take repeal off the table, once you take this massive tax cut for the wealthy off the table, we are ready to pull up a chair and sit down at that table. Wouldn't it be a breath of fresh air in America in this day and age, in light of all that's going on, if Democrats and Republicans worked constructively together to make the healthcare system better, more affordable, stronger for families and businesses across our nation? I think that's why we were sent here. I think that's the reason we're supposed to be here. And I sincerely hope that happens next. So we're ending the debate in the Senate this week, but we're not ending the debate in America. I urge those who think this is an important issue, and I'm one of them, to speak up and to go home. I'm going home soon, and to meet with people and have a conversation about where we go next as a nation. We can solve this problem, and I know we can do it in a constructive way. And if we show that kind of bipartisan leadership in the Senate, I think the House will join us. I think they'll do the same thing. I think they can have a bipartisan approach too. What a relief it would be, with all of the breakdown in comedy, all of the breakdown in communications politically, the warring camps that have become the American political scene, if we could show why there is a Senate and why there is a House and why people run for these offices. It's to solve problems, not to put out a press release, not to stake out a political position, but to solve a problem. This is a problem that needs solving. I hope over the next week that both parties will reflect on it. When we return after the 4th of July recess, we can roll up our sleeves and go to work. Mr. President, I yield the floor and suggest the absence of a quorum.